giving you something for pain. A little stick here, a little burn. So guys, today we're doing a male pellet. I'm using bioidentical hormones to help with symptoms that we unfortunately get as part of aging. And we have Patrick here who has been doing this for some time. Hi Patrick.
Hello.
So how do you feel when you do the pellet?
Good. A little anxious sometimes, but that's normal. Usually it's relatively painless.
The procedure, you mean?
Yes.
And what has your experience been since you've been using the hormone treatment, the pellets?
Definitely an increase of energy and just overall physical well-being. I feel much better, more concentrated, less lethargic.
That's good stuff, isn't it?
Yeah, it is.
Very good. Well, I'm so glad that you're feeling better. So I'm using bioidentical pellets. So these are molecules that are essentially the same or similar molecules to what your body is used to making. So they're more natural. They're made from natural sources, and they tend to be tolerated better and have fewer side effects. So one of the reasons I like to use the bioidentical hormone pellets in men is that guys either have to, use creams or something where they have to inject every day or use the creams every day, and the levels don't quite get as high as they need to, and they can be, rubbed off of their skin to their partner, or they tend to be not as good. So the pellets really tend to stay stable, and you can get 5 to 6 months with one insertion for the guys. So there's going to be a series of pellets that I put in. Each pellet is about the size of a grain of rice, and everybody's pellets are different. So it's an individualized treatment. So Patrick's dosage and somebody else's dosage may be completely different. It has to do with his levels, how he's feeling, what we're trying to get to. Now he is going to be sore afterwards for a few days. And Patrick, you can take some Tylenol for discomfort if you need to. And no leg exercises, no baths for about 5 days. You may also have some bleeding afterwards, and if you do, put some pressure on. And if it doesn't get better, I want to hear about it. But usually, most times it goes just fine. The key after pellets for men is they get this burst of energy and they want to go exercise, right Patrick?
Correct.
And they do have to fight that urge, because if they overdo the activity right after the pellet, there's a higher risk that the pellets will come out, and that's no fun. I don't think that's happened to you, right?
No.
You're a good patient.
Correct. I've only bled once, but it's very minor in nature.
Yeah. And typically it's a very, very thin guy who just can't resist the urge to work out. That tends to be a common theme where we see that expulsion of the pellets. But that's pretty rare too. So I'm just going through the same incision and just depositing each pellet in a different location. So who is doing the insertion and deciding the dosage is really the key when you talk about alternative medicine. It's not a standard where everybody gets the same amount. So you go to a regular physician and there's their favorite dose, so that's what they get. When I'm treating a patient, that's all I'm treating. I'm treating that particular patient, and all my decisions are individualized for that patient. So I think that's part of the reason they tend to have better results as well. So when you guys pick a practitioner, a physician that you're going to see, make sure that physician has experience and has empathy, can relate to what's happening, and understands what you're going through and how to treat it. So I am done with the insertion, and now I'm going to just close up this area. As you can see, he's not really bleeding from here. It looks pretty scary, but it's just a small incision. And I'm just using some medical grade glue to bring the skin edges together. And Patrick, don't forget, you gotta keep it covered for as long as you can.
Correct.
Try not to let that water get in. What do you think? Anything you'd like to add to what I said?
No, roughly 5 to 7 days. Don't shower for 24 hours, and then don't submerge yourself underwater in a pool environment for at least 5 to 7 days.
That's right. But overall, is there any words of wisdom to people out there?
No, I think you'll enjoy it. The first time is the best. You'll experience the difference.
Isn't it?
It is.
I know, it's awesome that first time.
Yeah. After that, it's pretty routine. I'm glad that I'm doing it.
Yeah, that first time is kind of scary too. It's a leap of faith. And now I've put on a sterile watertight dressing on. If you could please reach back here, let's put some pressure on. That's all, folks.